Our conversation with Mr. Steve Wolfe is brought to you by Marcus & Mack, a law firm representing injured people. Good morning.
Hey, Todd, how are you?
Wonderful. And it's good to have you on the air with us here this morning. We've got a lot to clear up here in the next 15 minutes or so. We might make this 15 hours or so. This conversation could go on, couldn't it?
Well, I hope I can help.
Well, I'm sure that you can. At the top of everybody's minds right now is, of course, the COVID-19 vaccine and how it will be distributed, what the various ramifications are for people here in Indiana County and for the Indiana Regional Medical Center. We talked yesterday with Dr. Richard Neff, the CMO, who told us that the freezer is in place for the reception of the vaccines. The announcement from Pfizer coming yesterday. Things are finally beginning to look up, aren't they?
Yeah, I mean, I thank the Lord that this is happening. The vaccine being approved is a true light at the end of what's been a long tunnel, and it's exciting. I mean, this has really been, approved and through at a, record speed, and doses were made in parallel and pre-distributed. So I believe that the Operation Warp Speed has been very successful, and it's going to get the vaccine in the hands of people in a lot quicker method than what we would have seen in historical times. So it is good news, and it comes at a good time as the COVID cases are rising.
One of the interesting things to me about you is your background in pharmacy. Probably it gives you a little bit of insight into how these things actually happen, and you said it yourself, the speed with which this has happened. It's typically a very slow process, but Operation Warp Speed really was fast.
I mean, I think, 2 to 4 years would not be unusual as a quick time for vaccine development. So this really was dramatically different, and I believe that President Trump and the makers of the vaccine companies and all those that worked so hard, and Congress, all those who helped to make this all come together, really deserve credit for that.
Let's talk about the actual distribution of the vaccine, when it is available to Indiana County. Probably you're meeting every day I know you're meeting every day to talk about COVID, but those meetings have to focus a little bit on what will be the distribution protocols, when is it going to get here? What sort of insights can you share with us this morning?
The Department of Health has not been very forthcoming with a lot of information. So I don't know that I know a lot. What we heard mid-last week was that Indiana Regional would be receiving, we're told, about 975 doses of vaccine. And we're supposed to focus that on, frontline healthcare workers, and that they will be distributing to other places in the community, such as nursing homes, directly, and that they're working with some, independent third party that will be involved in community vaccination. And we really don't know any details of that. They have not told us when to expect vaccine, but based on what we're reading, we think with the approval yesterday for the Pfizer vaccine by the FDA for the emergency use authorization that, we could get some next week, and we are ready. As you mentioned already, we have the freezer that gets down to 70 below or lower for the Pfizer vaccine, and then the other vaccine that will likely be approved is a different freezer, and we have that as well. So we can store a lot of vaccine here if people don't have these special freezers. So we're happy to help in any way that we can. We have our vaccination plan ready to go to start vaccinating people as soon as we get the vaccine. So hopefully next week we'll get started on that.
That being the Pfizer vaccine, that's the 2-dose one, isn't it?
Yes. It is a 2-dose one. They're 21 days apart. The other one is 2-dose also, and they're 28 days apart. Mm-hmm. And then there's a whole host of them that are still coming, and I'm not sure that I know all the details on that, but the Moderna vaccine that is following the Pfizer is a 2-dose as well.
The vaccine itself, does it require any special training in terms of how it's administered, or is it just the standard vaccine shot?
Yeah, I believe it would be just very similar to any vaccine, and I don't believe that you need to have any special training for that. It is obviously super cold, but it's brought to room temperature before it's administered, and there is a stability at room temperature. I believe it's for 48 hours. So
things are looking up in that respect, and so we're looking forward to it coming to Indiana County. Of course, over the course of the first 6 months of 2021, we're going to get continual updates, I would assume, on when the next batch is going to come in, how folks can go about getting it. Just as through the beginning stages of the pandemic, when we were telling people let's not overrun the hospital or overwhelm the hospital, I'm sure the advice is just wait patiently, and you will be informed when a vaccine is available to you in whatever circumstance somebody happens to be.
yeah, I wish that we had more information, but it does not appear that they're looking for the hospital to play any role in the immunization of the community. We're certainly honored to do that if they need us to, but at this point they seem to have their own mechanism in the time frame for that and how they're going to get that information out and how they prioritize that in the community at large. We don't know those details. I'm sorry about that.
Meanwhile, you do continue at the Indiana Regional Medical Center to operate, and as well as is possible during this time. I want to ask you about the morale of the folks on the staff. I know that you've got some real champions at IRMC, and it doesn't matter who you're talking about, doctors, nurses, staffers, people are really stepping up, and so how are they holding up through all of this?
Todd, I've never been through anything like this. I don't know that any of us have been. This might be a once-in-a-100-year event. And, I mean, people are really laying it out there on the line. We're being stretched. It's, rising case counts and certainly, lots of concern. I'm rounding every day through the ICU and the COVID units and the ER. And I mean, just incredible, the commitment, the dedication. Are people tired? Yes. Are they, being stretched? Yes. And am I worried about, morale and things as we continue to look at least, several more months of this? And I mean, the answer is yes. And every hospital in the state of PA, I'm on the HAP board, is, having the same issue with people working so hard and so long, and all this PPE garb gets tiring. And I do hope that this vaccine is a light for people that they can focus on. So they're really hanging in there. I'm incredibly proud of them, and I think the community here would be just amazed at their dedication and commitment. They're just grounded in why they got in the profession they did, and well, maybe not. Some of them never thought they'd be in a time like this. They've really stepped up, and so it's a tough time right now. But we're treating the patients. I think we're still open for business in terms of, handling, OR cases, outpatient testing. And there's been a lot of, creativity and process changes to really make sure that we can continue to do that. And, safety is always at the top of everything we do for the patients and for the staff.
We're talking with Indiana Regional Medical Center President and CEO Steve Wolfe this morning here on Indiana in the Morning. We hear statewide and across the nation that there are shortages of PPE supplies, shortages of vaccines as well, that are causing facilities to cut back on administering them to staff and to people who come in and use their facilities. Are there any of those concerns with Indiana Regional Medical Center? Are you confident you're still going to have the resources to do what needs to be done?
I believe that, our PPE is in a good position right now. I mean, do we worry about things on our daily call? Yes, in terms of what we're using and, would a shipment, be commandeered by the government or something? But right now we're really hanging in. It was a real issue early on as the supply chain was, so disrupted. Fortunately, some of that's recovered. And right now, I believe, we're hanging in there in terms of medications or anything. So I think, we're doing well. I think it's a bit of a wait and see now. Just what's going to happen from here. Some of the models really show continued increasing, and it's going to be really challenging on the healthcare system if that continues, because nearly everybody is really stretched at this point in time.
Well, we certainly pray that the vaccine will be one of the lights that are coming toward our way, and things will begin to brighten a bit for all of us. And certainly Indiana Regional Medical Center is going to be there right at the front, leading the way. Steve Wolfe, thank you so much for being with us this morning. It's been informative, and I know that there are a lot of stresses on you and on everybody else at IRMC, but we're praying for everybody there.
I appreciate it. I pray every day when I get in my office and every day when I leave, and it's the staff, the physicians, and those who are out there touching, talking, and taking care of the patients that are the real heroes. I got the easy part, Todd. So thank you for your prayers and support.
All right. Have a wonderful day today. We appreciate it.
See you, Todd.
Bye-bye. There's Steve Wolfe with us here this morning, the president and CEO of the Indiana Regional Medical Center.